Hello everyone, on behalf of Mojo Aramesh Amitis Health Tourism Company, I'm here with you today to introduce to you another medical treatment that we offer to foreign patients and medical tourists in Iran. Today's topic is a weight loss procedure that is called Sleeve Gastrectomy, or commonly called gastric sleeve surgery, which is a surgical procedure as opposed to gastric balloon, which is not surgical, that we covered in our previous video. It is performed laparoscopically, which means inserting small instruments through multiple small incisions in your upper abdomen and removing about 80% of the stomach and leaving behind a tube-shaped stomach in the size and shape of a banana, if you want to imagine it. How it works is that it limits the amount of food you can take, and it also causes some hormonal changes that contribute to weight loss. The same hormonal change can help you with relieving the conditions that are associated with being obese or overweight. What are these conditions? Heart disease, high blood pressure, type 2 diabetes, cancer, infertility, stroke, and obstructive sleep apnea, and etc. This, as any other weight loss procedure, this procedure too is only recommended if you have if you have not lost weight through following a diet or exercise. Who are good candidates for this procedure? This procedure is recommended for people whose body mass index, or BMI, is above 40 and are considered morbidly obese or extremely obese. Or people with lower BMI from about 35 to 39.9, but are suffering from serious obesity conditions that are associated with obesity, like type 2 diabetes. Even lower BMI can also make you a candidate for this procedure if you suffer from serious conditions that I mentioned. These are your condition is determined by your doctor, and again, for this procedure too, you need to be willing, you must be willing to change your lifestyle to a healthier type, following a healthy diet, regular exercise for the rest of your life, and specifically for this procedure, which is considered a bit heavy, you need to go through follow-up plans of nutrition and psychotherapy and exercise for a long time, in the long term. As with any other surgery and weight loss surgery, there are risks associated with this, with gastric sleeve too. There are short-term and long-term. The short-term side effects usually include excessive bleeding, infection, allergic reaction to anesthesia, and longer breathing problems, which are short-term. The long-term side effects, which can be rare but still can happen, are gastrointestinal obstruction, hernia, gastroesophageal reflux, and malnutrition, vomiting, and in very, very rare cases, this procedure can be considered fatal. How you prepare for this procedure? In the weeks leading up to the surgery, you may be instructed to follow a physical activity program, and you may be restricted by your surgeon or doctor to to have restrictions on eating and drinking and the medications you take, and you need to stop using tobacco of any kind. And this procedure is done for about 1 to 2 hours under general anesthesia in a hospital, after which for 1 or 2 days you need to stay at the hospital. It is not an outpatient procedure. What happens during the procedure is that depending on your individual condition and the specifics of your health and the practices of your doctor, the procedure is performed. And in rare cases, the procedure is done via large incisions or open incisions, but typically it is done laparoscopically through small incisions, and inserting an instrument into your stomach to and the doctor then will staple your stomach and narrow your stomach and stapling it and removing the excess part. That is the whole procedure, which takes about 1 to 2 hours, and you will awaken in a recovery room, and the hospital staff will monitor your condition for 2 days. After this procedure, you need to maintain a very strict diet. For the first week, you need to follow a liquid, non-sugary, and non-carbonated liquid diet. In the next 3 weeks, you will have to have a pureed or soft foods, and after a month after your surgery, you can return to a regular food diet. But in the next several months, you will be instructed to have medical follow-ups with your nutritionist, with your doctor, and continue monitoring your weight loss progress. And for the rest of your life, you will be prescribed to take multivitamin and calcium supplements and vitamin B12 injections once a month for the rest of your life. These are things that your surgeon will instruct you and prescribe for you based on your conditions. This weight loss procedure can help you relieve conditions like heart disease, high blood pressure, as I mentioned, stroke, infertility, high cholesterol, etc. And it will enhance the quality of your life. And for some, it will make it easier for them to go back to their normal daily activities, which they couldn't do normally before the surgery. After the surgery, because of the rapid weight loss, your body may react to the new conditions, and you can experience either any of the following conditions like body aches, hair loss or hair thinning, feeling cold, dry skin, and feeling tired and fatigued, mood changes, etc. These are the risks that you have to take to lead to a healthier lifestyle, and you must be committed to a new lifestyle for the rest of your life, with regular exercise and healthy diet, and following up with your nutritionist or your surgeon for several months. If you do this procedure may not work for some people in rare cases if they do not commit to a new healthy lifestyle, and they may even regain weight or not lose weight, which is not so good news. And if this happens to you, you will need to consult with your doctor immediately. The result of this procedure is that it is reported that within the first 2 years you can lose up to approximately 60% of your weight, and it all depends on your willingness to maintain a healthy lifestyle. I'm sorry to repeat it again and again, but that is the key for the success of this procedure. What we offer to you in Iran as Moja Aramesh Amethyst Health Tourism Company is that we have prepared packages that cover all medical expenses and the surgery for you, that the packages without excluding actually accommodation, the package starts from $2,490, and if you wish to have accommodation for 5 nights, we offer our silver package, which starts from $2,640 for 5 nights stay in a 3-star hotel, and for a 5-star hotel accommodation the package will rise up to $2,740. The medical service, the quality of the medical service is the same in all packages. That is the gist of this procedure. And if you have any questions or any doubts about this procedure, please contact us through our social media channels like Instagram, Facebook, or our website amethystmedtour.com, and we will get back to you as soon as possible with answering all your questions. Thank you for your time, and bye.